afternoon.
Hello.
How are you?
I am doing great. How are you?
I'm good. So first, gratitude and thank you for taking some time off from work in the middle of the day and coming here to spend a few minutes to talk about your journey.
It's my pleasure.
Many people will appreciate this, I believe, because if you recollect, you came to an event that we had a couple of months ago.
Yes, sir.
And you met a lot of people and you heard a lot of, ideas, and you saw a lot of before and after pictures, and you actually met one or two people who actually went through surgery. And I think that made a difference for you. And just the same, what you're going to speak about hopefully today will make a difference for other people.
I hope so.
Okay. So first of all, what did you have done in the last, now almost 2 months ago?
Yes, it's been just over 2 months, and I had the lower face and neck lift surgery, as well as the upper lids.
Yeah, you don't have to worry about specific terminology. You can even just say improve, whatever. That's okay. I can fill the gap. So you had, technically speaking, a lower face and neck lift surgery because you had a lot of extra loose skin and maybe some fullness because you lost some weight.
I sure did.
Yeah.
So in the past few months, I've lost about 45 pounds, and that made me even more aware of the problem that I was seeing for the past couple of years with aging with my neck. So I am 65 years old, lost totally about 45 pounds thus far. I'm still working on probably about 20 more pounds. And at this point, I'm glad that I made the decision of having this surgery. I think it's one of the greatest things that I've ever done. One of the greatest decisions I've ever had to do.
What compelled you to lose the weight? I mean, was it difficult on your knees, or you just felt like you wanted to be healthy? What motivated you?
Yeah, a couple of things. Basically realizing the age. This has been probably since 2022. COVID was really hard on me. I've gained a lot of weight, and I just decided to just try to have a better look for myself, and of course improve my health. And I did have a problem with my left knee, so that is almost gone. It's definitely improved just having that weight loss. And but the bottom line was just feeling better and looking better.
And did you do that on your own, or did you take some help with some injections and?
I did it on my own, pretty much.
So what did you do? I mean, did you do diet, exercise, all of the above?
I did. The exercise was a little bit limited at first because of my left knee. I was a little bit constrained there, but pretty much just being more aware of what I was eating. I cut a lot of
carbohydrates
and lots of walking, not just at work, but also at night. Lots of walking, and that really helped.
And since surgery, you've been maintaining the same discipline?
Yes, pretty much, correctly.
And so, since the surgery, which was now 2 months ago, again to reiterate, we improved your neck, we improved your jawline, we improved a lot of things of the lower part of the face, and we also improved your upper eyelids, because there was a lot of heaviness.
Yes.
Having done all of that, how much weight did you lose since surgery?
So since surgery, I've lost probably another 15 pounds.
So surgery itself was motivating for you?
Oh, absolutely, yes.
So tell me about the surgery first, so people would want to know what motivated you, how did you learn about it, what finally made you decide to do the surgery?
So the surgery was a journey because first I just wanted to do a lot of research. I tend to be a person that pays a lot of attention to details.
You're an engineer.
I am a civil engineer, yes, correct. And you really played a tremendous part in that because you had so much patience and attention to my questions that it just made me feel good. I think a patient really needs to have that good relationship and feel comfortable with the doctor, and that's exactly what happened here, not just with you, but also with your staff. So having said that, I just came to that event. It was actually April 3rd, and I'm so glad that I did because it was really awesome to be able to see firsthand pictures of surgeries and also meeting people that went through the surgery. And that was just the last straw that I needed. At that point, I was just like ready, and it was just a matter of making the decision and setting the surgery date.
And so you also had a unique experience because you initially did not want to do anything about your eyes.
Correct.
And so, as a matter of fact, after your neck and lower face surgery, we did your eyes just, I think, 2 weeks afterwards.
Correct.
So what happened there, and why did you decide that as a second step instead of doing it all together?
I should have done it at first. So I think that was just my lack of sight in terms of it should have been done together. And the reason was I thought I was not going to do it, and I realized, again, with your help and expertise, understand that it was something much needed, not maybe at this point, but definitely down the road for sure. So I would recommend to whoever to actually consider it and have it done at one time.
Well, I mean, whatever is done in combination, right? I mean, some people need some things, other people need other things. So that's why initial consultation is so important, so that you can analyze and assess and determine what's suitable for that individual sitting in front of you. So I felt you need an upper eyelid surgery done at the same time. You didn't want to, or you weren't convinced yet, but soon after you realized, and we went ahead and did it. So another person may not need an upper lids, they may need something entirely different. So many times, for example, I may even do laser work for their face, which I did, later for you as well, right? So it depends on the person. That's why it's extremely important to have an in-depth consultation and discuss what is actually needed and what should be done and at what stages and how many different things to do or why not to do something, for example. So anyway, how was the recovery process of the surgery after the surgery?
The recovery process just went as expected. You explained the process, the pain level. It was manageable. Of course, the medication helped.
How long did it take for you to feel like I'm not like I'm okay?
Yes, well, the first couple of days was, or maybe the day after or so was, I still had the effect of the anesthesia. But after that, I would say probably, I don't know, a week or really not that long.
And is there anything that you felt was the toughest for you after surgery that you had to overcome? Is it sleep or positioning, or is it eating? What do you think was the toughest thing?
It's funny you ask, because it wasn't really the pain. It was more of my position of sleeping, because I have some back problems. And I wanted to make sure that I followed the directions from you, and that was just to be kind of elevated but not flat and on your back. And so I make sure that I retain that position throughout the night. And again, only because of my back issues, but it wasn't really, in fact, I'm still doing it today, and it's been 2 months.
So did you feel like you were pretty well prepared, going into it? And was it about what you expected? Was it harder than expected or easier than expected?
I think it was easier than I expected, because having looked so much into the surgery and the research that I did, first of all, again, the time that you took to explain it, the questions that the answers that I got for my questions, and the coaching was really tremendous, and I think that made a big difference. So I would think it's probably easier than I really expected. I looked too much into it.
How did your husband, for example, was he supportive? How was he? How did he manage all of the time that you were here?
I am so glad you're asking me that, because he has been a trooper. He came to that event actually, and after I kind of looked at him and I said, I'm seeing all these photos, I'm getting all this information, I'm seeing testimonies from patients. I think I'm gonna do it. And he just looked at me and he said, well, what are you waiting for? This is a no-brainer. You have to do it.
How did we first meet? Do you remember?
Oh my goodness, I'm aging myself here. So we were actually in high school. We're high school sweethearts, and we've been married for 45 years. We were 20, and we went to school together. He's also an engineer. So we've been, partners in crimes, lovers, friends, everything for 47 years.
Congratulations.
Thank you.
So well, I think, as a surgeon, it gives me immense pleasure and joy to do what I do when I meet people like you, because you are an educated person, you are a conscientious person, you're somebody who follows direction very well, you have realistic expectations, you have questions that you ask and understand, and you're willing to listen. And I think the relationship that you and I have built together of mutual understanding and trust is very critical. And clearly, the outcome I feel is great. But if I were to ask you, how would you rate on a scale of 1 to 10 your overall outcome with this lower face neck lift surgery and your upper eyelid surgery? How would you rate it?
Over 10. Over 10. And basically, you just really touch on something very important. You need to follow directions. You need to listen to your doctor, to his staff, and make sure you do everything right, because that's going to help you in the long end, because you're going to recuperate better, easier, and just get back to your own self looking much, much better.
Wonderful. Thank you so much.
Thank you for everything. I am truly and honestly grateful for the rest of my life to you, Dr. Kusuma. Thank you.